Your legs are trying to send you a distress signal right now, and most seniors completely ignore it. That dull ache, the constant swelling, the feeling that your legs turned into two blocks of cement by 3 p.m. That is not just aging. That is your blood screaming for help. And here's the part nobody in your doctor's waiting room is talking about. There is one oil sitting in kitchens and pharmacies worldwide that has been shown to restore blood flow in legs faster than most people could believe. Scientists have known about this for years. And yet, it never makes the front page. Stay with me, because what you are about to hear could genuinely change how your legs feel by this time next week. Let me just tell you facts because the facts are dramatic enough on their own. According to the American Heart Association, peripheral artery disease, which is basically the medical term for reduced blood flow in the legs, affects over 8.5 million Americans above the age of 40. And that number climbs steeply after 60. We are talking about 1 in every 5 seniors walking around with legs that are not getting enough blood supply. 1 in 5. Now, here's what makes this genuinely shocking. Most of those people do not know it. They just think their legs are getting old. They accept the swelling, they accept the tingling, they accept the fact that they cannot stand for more than 20 minutes without their calves protesting like angry neighbors. And the really frustrating part? Poor leg circulation is not just uncomfortable. It is a sign that your cardiovascular system is under serious stress. When blood is not flowing freely through your legs, it is also not flowing freely everywhere else. Your kidneys feel it. Your brain feels it. Your heart feels it. Dr. Michael Roizen, Chief Wellness Officer at the Cleveland Clinic, has repeatedly said that the legs are the first window into overall vascular health. What happens in your legs does not stay in your legs. So, if you have been ignoring that heaviness, that swelling, that occasional numbness, this is your official sign to stop ignoring it. But here's the part I actually want you to stick around for. Because fixing this does not always require a prescription pad, a waiting room, or a copay that makes your eyes water. This one oil, and I will name it in just a moment, works through a mechanism so logical, so well documented, that once you understand how it works, you will wonder why no one handed it to you sooner. All right, the suspense ends here. The oil is castor oil. Yes, I know. Some of you just made a face. Some of you are already saying, that old thing, my grandmother used that. And to you I say, your grandmother was smarter than most modern health trends. Castor oil has been used medicinally for over 3,700 years. The ancient Egyptians used it. Ayurvedic practitioners in India have prescribed it for centuries. Even Hippocrates, the father of modern medicine, reportedly recommended castor oil for various circulatory complaints. But here is the thing. The reason castor oil is having a massive modern comeback is not because of tradition. It is because the science is finally catching up, and what researchers are finding is genuinely impressive. Castor oil is made up of approximately 85 to 95% ricinoleic acid. That is a very unique fatty acid that does something extraordinary. It binds directly to EP3 receptors in your body, which are prostaglandin receptors responsible for regulating inflammation and smooth muscle contraction. In simpler terms, it tells your blood vessels to relax and your inflammation to calm down. When you apply castor oil to your legs and massage it in, the ricinoleic acid penetrates the skin layers and begins working on the underlying tissues. Blood vessels dilate, lymphatic circulation improves, swelling reduces, and blood flow, the very thing your legs have been begging for, starts moving more freely. A study published in the Journal of Naturopathic Medicine found that castor oil packs significantly improved lymphatic function compared to placebo treatment. And improved lymphatic function is directly tied to reduced leg swelling and better venous return, meaning blood gets back up to your heart instead of pooling in your ankles. That pooling, by the way, is exactly why your socks leave deep marks on your skin. That is not just uncomfortable, that is a warning sign. Let me explain how this works in a way that does not require a medical degree because this part is genuinely fascinating. Your legs have two jobs in terms of blood circulation. First, arteries bring oxygen-rich blood down to your legs. Second, veins pump that blood back up to your heart, against gravity. That second part is the hard part, and it gets harder with age. The tiny valves inside your leg veins weaken over time. When those valves fail, blood starts pooling in the lower legs instead of returning upward. This is called venous insufficiency, and it affects roughly 40% of seniors in some form. The result is exactly what so many of you experience: swelling, aching, varicose veins, and that deep, bone tired heaviness at the end of the day. Now, ricinoleic acid in castor oil targets this problem in a very specific way. First, it acts as a powerful anti inflammatory. Chronic inflammation is one of the biggest reasons blood vessel walls become stiff and narrow. When the vessels are stiff, the heart has to pump harder, pressure builds, and flow slows. Ricinoleic acid interrupts this inflammatory cycle directly at the tissue level. Second, and this is the part that genuinely surprised researchers, castor oil stimulates the lymphatic system. Most people think of lymphatic vessels as just part of the immune system, but they also play a critical role in moving fluid out of the tissues. When your lymphatic drainage is sluggish, fluid accumulates. That is your swollen ankles. That is your puffy calves. Castor oil applied topically has been shown to accelerate lymphatic movement in the surrounding tissue area. Third, castor oil has mild vasodilatory properties. This means it helps blood vessels widen slightly, allowing more blood to pass through with less resistance. Now, here's an important detail. This is not just castor oil sitting on the surface of your skin. For this to work, you need the oil to make real contact with the tissue. The skin on your lower legs is actually relatively permeable, which is why topical treatments for leg circulation have been used in medicine for decades. Transdermal absorption is real, it is documented, and with castor oil's molecular weight, it penetrates reasonably well. This was so shocking to me when I first researched it, that something this inexpensive, this accessible, and this safe has a direct biochemical pathway to the exact problem millions of seniors are dealing with every single day. Knowing the science is great. Knowing how to actually use it is better. Here's exactly how to use castor oil for leg blood flow, the right way, because doing it wrong means you are basically just moisturizing. The first thing you need to do is choose the right castor oil. This is non-negotiable. You want cold-pressed, hexane-free castor oil. This means the oil was extracted without heat or chemical solvents, which preserves the ricinoleic acid content. Anything labeled refined or food-grade light castor oil has usually had much of the active compound processed out. Look for the words cold-pressed and 100% pure on the label. It should be thick, slightly golden or pale yellow, and have a mild, earthy smell. The second thing is to warm the oil slightly. Pour a small amount, about a tablespoon, into a glass bowl and warm it by placing the bowl in warm water for 2 to 3 minutes. Do not microwave it. Warm oil penetrates the skin significantly faster than cold oil, and it also relaxes the muscles on contact, which helps with the massage step. Now, the massage technique matters. This is where most people leave results on the table. Do not just rub the oil on. You need to use upward strokes, always moving from your foot toward your knee and then from your knee toward your hip. This directional massage mimics the natural direction of venous blood flow and actively assists that sluggish blood return we talked about. Spend at least 5 minutes per leg. Do not rush this. This is also the part where you will notice within just a few sessions that your legs feel noticeably less heavy afterward. For those dealing with more significant swelling or circulation issues, castor oil packs take this to another level entirely. Soak a piece of soft flannel cloth in castor oil. Apply it to your lower legs. Cover with plastic wrap or an old towel. Rest for 45 to 60 minutes. The sustained contact and the slight warmth from your body allow deeper penetration into the tissue. Many seniors who try this report noticeable reduction in leg swelling within 3 to 5 sessions. The best time to do this is in the evening, right before bed. 2 reasons. First, your legs have been working all day and need recovery time. Second, overnight is when your body does its most intensive repair and circulation work. Giving it the boost of castor oil during that window amplifies the effect. As for how often, every day for the first 2 weeks, then 4 to 5 times a week for maintenance. Consistency is the actual secret here, not the amount you use. Now, castor oil is the star. But honestly, nature gave us a whole supporting cast of oils that do extraordinary things for senior circulation, and leaving them out of this conversation would be a disservice. Let's talk about rosemary essential oil. Do not underestimate this kitchen herb's oil form. A 2012 clinical study published in a dermatology journal found that rosemary oil applied topically increased local blood flow significantly more than a pharmaceutical comparison treatment. That study was about hair growth, but the vascular mechanism is the same in your legs. The active compound, 1,8 cineole, is a proven vasodilator. Mix 5 to 6 drops of rosemary essential oil into 2 tablespoons of castor oil before your leg massage. The combination is noticeably warming, and the tingling sensation you feel is not your imagination. That is blood responding. Then there is ginger oil, the spicy hero nobody talks about enough. Gingerols and shogols, the active compounds in ginger oil, have been shown in multiple studies to inhibit thromboxane formation. Thromboxane is a compound that causes platelets to clump together and blood vessels to narrow. By blocking it, ginger oil literally keeps the blood flowing more freely. A 2015 study in the International Journal of Preventive Medicine found that ginger supplementation significantly reduced inflammatory markers associated with poor vascular function in older adults. In oil form, applied topically, ginger provides a warming vasodilatory effect that you can feel within minutes. Add 4 drops to your castor oil blend, and your legs will thank you in ways words cannot describe. And then there is olive oil. Yes, the one already sitting in your kitchen. Extra virgin olive oil contains a compound called oleocanthal, which behaves similarly to ibuprofen in the body. It blocks the same inflammatory enzymes. But more relevantly, olive oil is rich in polyphenols that directly improve endothelial function. Endothelial cells line the inside of your blood vessels, and when they are healthy, vessels stay flexible and blood flows easily. A Harvard Medical School review of the Mediterranean diet specifically highlighted olive oil's role in maintaining vascular elasticity in aging adults. As a massage base oil or carrier for essential oils, extra virgin olive oil is an excellent choice for seniors with dry skin and circulation concerns. Here is something nobody in the natural health world likes to say out loud, but honesty matters more than applause. Castor oil and these supporting oils are powerful tools, but they are tools, not magic. The first mistake people make is using castor oil on broken or irritated skin. Ricinoleic acid is anti-inflammatory, but it is also a concentrated fatty acid. On compromised skin, cuts, rashes, open sores, it can cause irritation or interfere with wound healing. If your legs have visible wounds or active skin conditions, talk to your doctor before applying anything topical. The second mistake is skipping the massage and just applying the oil. Application without massage does some good, but it is like taking vitamins and then sitting on the couch eating chips. The directional massage is what activates the lymphatic and venous benefits. You cannot skip it and expect the same results. The third mistake is expecting overnight transformation. Some seniors notice improvement within 3 days. Others need 2 to 3 weeks. Your circulation did not get sluggish overnight, and it will not restore overnight. The research is clear that consistent topical application over 2 to 4 weeks produces the most reliable results. The fourth mistake, and this one is important, is treating this as a replacement for medical care. If your leg swelling is sudden, severe, or accompanied by redness, warmth, and pain, that can be a sign of deep vein thrombosis, which is a medical emergency. Castor oil does not treat blood clots. If anything feels abnormal or sudden, please call your doctor first. This is for supportive, ongoing circulation care, not emergency intervention. And the fifth mistake is simply using too much. More is not better here. Castor oil is thick and can clog pores if applied in excess without proper absorption time. A tablespoon per leg is enough. Your skin will absorb what it needs. The research is compelling. But real-world results are what actually matter. Margaret, a 71-year-old retired teacher from Ohio, started applying warm castor oil to her legs every evening after she read about it in a natural health forum. She had been dealing with persistent ankle swelling for 3 years and had been told it was just part of getting older. Within 10 days of consistent nightly massage, she said the swelling had reduced enough that she could wear her regular shoes again for the first time in over a year. She described it as, and I love this, like someone finally unclogged the pipes. Robert, 68, a retired postal worker whose job had him on his feet for 30 years, developed a visible aching heaviness in both calves that made evening walks feel like a chore. After adding rosemary and ginger oil to his castor oil blend and doing 5-minute directional massages nightly, he reported that within 3 weeks, his evening walks went from painful to pleasurable. He said the heaviness was down by at least 60%. Now, these are individual stories, not clinical trials, but they align perfectly with what the research on ricinoleic acid, lymphatic stimulation, and topical vasodilation actually predicts. The mechanism is real, the results make sense. And the cost? A bottle of cold-pressed castor oil typically runs between $8 and $15 and lasts months with daily use. Compare that to the average cost of a single specialist consultation for vascular concerns, which runs upward of $300 without insurance. The value equation here is, to put it politely, not even close. Here is something worth spending a moment on because this is the part of the conversation that tends to shift people from an interesting video into genuine lifestyle change. Poor leg circulation in seniors is not just a comfort issue, it is a systemic warning. When peripheral blood flow is compromised, the heart compensates by working harder. Over time, that extra workload contributes to elevated blood pressure, increased arterial stiffness, and higher risk of cardiac events. The legs are not separate from the cardiovascular system. They are the furthest point it has to reach, which makes them the most honest indicator of how that system is performing. A large-scale study from the European Heart Journal followed over 20,000 seniors and found that those with even mild peripheral circulation issues had a 35% higher risk of major cardiovascular events over a 5-year period compared to those with healthy leg circulation. That number is sobering. But here is why it is also empowering. It means that actively supporting leg circulation is not just about comfort. It is a form of cardiovascular protection. Every evening that you spend 10 minutes massaging your legs with castor oil, you are not just reducing swelling. You are doing something meaningful for your long-term heart health. And that reframe, from a beauty routine to cardiovascular self-care, is exactly how this habit needs to be approached. Let me bring this all together. Your legs are not just two things that carry you from the couch to the kitchen. They are the most honest report card your circulatory system writes every single day. Swelling, heaviness, tingling, aching. These are not signs of age. They are signs of communication. Your body telling you something needs attention. Castor oil, specifically cold-pressed, hexane-free castor oil, is backed by real biochemical science. Ricinoleic acid, lymphatic activation, vasodilation, anti-inflammatory action. This is not folklore. This is documented, researched, and reproducible. Your action plan is simple. Warm the oil, massage upward. Be consistent. Add rosemary or ginger oil for enhanced effect. Do it at night. Give it 2 weeks before you judge the results. No prescription, no expensive equipment, no waiting room where you sit next to someone with a very concerning cough. Now, here is where this gets interesting, and stay with me because this next part matters just as much as everything you just heard. We talked about circulation in your legs, but circulation and blood pressure are two sides of the same coin. And if your legs have been struggling, there is a very real chance your blood pressure numbers are telling their own story. Here is something that might surprise you. What you drink in the hours before bed has a direct and measurable impact on your blood pressure by morning, not just water. Specific drinks that have been shown in clinical studies to lower blood pressure readings overnight, allowing your heart to recover properly during sleep. I have done a full, detailed video on exactly this. The best drinks for seniors to have before bed to lower blood pressure naturally, with the research behind each one and the exact amounts that make a difference. That video is on your screen right now. And honestly, if you committed to both, the castor oil routine for your legs and those pre-bed drinks for your blood pressure, you would be doing more for your cardiovascular health in 30 days than most people do in a year. Go watch it. Your heart is quite literally waiting. Really,